Today we are graced with the lovely Krista. She is our assistant office manager and treatment coordinator extraordinaire. Krista, it's so great that you're hanging out with us today. I don't normally get to see you because you're usually at our Henderson oral surgery office. How was your day?
It's been great, actually. I came and helped a little bit today, which was really wonderful, so I missed working with you.
You made our patients feel so at home.
Yay.
Yeah, how have you been? How's your week been? Anything fun?
It has been a little nutty, but you know, summer times are always that way. We seem to be very busy in the summertime for oral surgery. You see a ton of teenagers, wisdom teeth. So it's definitely hit the ground running every day.
Of course. So, as I said, Krista, you are our treatment coordinator extraordinaire. But I'm gonna be really honest. So when I was a dental student and a resident, I actually didn't know what a treatment coordinator was. And I don't know that a lot of people know what a treatment coordinator is. So like when you're in dental school, there's no such thing as a treatment coordinator. You are, first off, you're the dentist, and you are the bill collector, you're the scheduler, you're the treatment coordinator, you are everybody. And then luckily residency is a little better. But when I got out and I found out that I would have treatment coordinators helping me, I couldn't believe it. I was so excited. So how would you explain what a treatment coordinator is?
Well, my best running joke would be I'm a jack of all trades and a master of none. But we are kind of your first source when you come into the office. I really feel like it's important that we have a lot of knowledge, that we're really well-rounded with dentistry.
Yeah.
I don't just go over oral surgery. Sometimes I even go over hygiene with people or make examples or recommendations for products and things for them. So education by far is number one. So you are a big teacher. You are explaining a ton of different things to your patients, but in very layman terms that they understand. Two, you are empathetic with these people. You are trying to be their friend and their family member and making good choices for their health care. Coming into an oral surgeon is a scary thing for people. So when it's navigated with somebody holding your hand and being empathetic and listening to you and going, oh my gosh, I've had the same experience, or asking questions and getting information from the internet or a doctor that's very technical is very difficult for people to understand. So I always use a lot of analogies in a lot of my presentations as well. But I would say, yeah, we teach you about your procedure, we make recommendations for you, we help you navigate financials. But again, jack of all trades, master of none.
So part of being a treatment coordinator is being able to read people and have like a level of empathy where you can understand the type of communication and the type of care that they need. Are there any like tells or signs of a patient that kind of give away, I don't know what type of patient they are or the type of person they are, that can help you basically do your job more effectively?
Being a treatment coordinator, I think that's number one. You need to read people, understand not only wants and needs, but their personality. And sometimes that's not teachable. I think that just sometimes comes with the way you are. But listening, I think listening skills are a big one. Once you kind of hear what they're here for and what their wants and needs are, then you can really navigate it much easier. A lot of people come in and they are clueless. They have no idea what they are getting themselves into, but feel very comfortable and confident once they understand. I have other people that have done a ton of their homework. They have done all their research. They feel like they're leading the conversation. And that's okay. We let them do the talking, try to put in a little bit of our own 2 cents to reiterate some of the things that we're going over, but you have to be prepared for those people because it's trying sometimes. And then you get the other people that are just super laid back and just totally trust you wholeheartedly. Those are the easiest patients. And they're like, whatever needs to be done, I'm here for it. Let's do it. I trust you.
I'm in your hands.
Yes.
Well, for the patients that come in and they have their own opinion already, or maybe they've obtained information that they truly believe is correct, but because of their specific patient circumstances that they might not be aware of, it may not be as correct, or it may not be the best thing for them. How do you approach those patients?
I think it's just the best education. The wonderful thing, like our practice, we have a lot of visual aids. We utilize the internet a lot. Really trying to let them understand sequence of events, really truly how the treatment works and what's most beneficial for them. Unfortunately, internet is always not the best source.
Yeah.
We WebMD ourselves all the
Of
time.
course.
So really
it always comes back to cancer.
constantly.
You have cancer.
Yep, exactly.
You probably don't. But
Yes. So
yeah.
it's just really coming back to that. I think that can be their worst enemy sometimes.
Yeah.
And really trying to get the facts straight and getting the
Absolutely.
right information.
Exactly. I think patients sometimes forget that information online is a very big blanket piece of information.
Yeah.
But everyone that walks through the door is an individual. They're different. They have different factors, symptoms, medical history. Everybody's teeth are different, from down to the shape of their teeth, the length of their teeth, their gums. So not everything is going to be the same for everybody.
Very true.
And I wish that patients could understand that. And that's what you're here for, and that's what I'm here for, to identify those factors so that we can get the patients the right treatment plan and care.
Yeah. I always say not one size fits all. Everybody
Absolutely.
is so different. I think wisdom teeth always seem like run of the mill, and every single one is so incredibly different.
Yeah, actually, when I was shadowing oral surgeons back when I was training, an oral surgeon out in Charlotte told me, I'm going to tell you, Christy, one of the easiest procedures that I can do are take out wisdom teeth, and one of the hardest things I do is take out wisdom teeth. Every tooth is different. You think it's just a tooth, but no, it could, like one tooth and one factor could literally be like, this one tooth can cause you, it could be a big tumor attached to it, and it can cause nerve damage, and you might get a jaw fracture from this tooth. Whereas like you can have a teenager that comes in and it's just one tooth is like, oh, no problem, we'll get it out super easy. It's gonna take 3 minutes.
I mean, ideally they would be textbook all the time.
Yeah, I know, but it is, everybody's different. You're
Absolutely.
Right. You're right.
Yep.
Going back on communication, and it got me thinking about this show that I'm really obsessed with. So one of my obsessions right now is Nathan Fielder and the show called The Rehearsal. Have you heard of it?
I have, yes.
Right? Yeah.
Yes.
Have you watched season 2 yet?
I have not watched any of them yet,
Oh,
but I do know the
It's
premise
super good.
of him rehearsing life scenarios before he actually follows through.
So season 2 is really interesting. So it's him delving into why plane crashes happen and like the root cause. And with these rehearsals, he was able to identify that communication may be difficult when there is a hierarchy system. And it got me thinking, like, that could be very applicable to many areas, but definitely in dentistry and oral surgery. So have you ever encountered that maybe communication might be difficult in a hierarchy in oral surgery or dentistry, in those times where it's difficult? Like, how have you overcome the difficulty?
I think, sometimes when you are having to educate patients a lot, you really need to make sure not only you understand what you're doing, but you're continuing your education as well. And sometimes with dentists, you're looking to them for guidance. You guys are constantly reading your journals and going to your training and, doing everything you can to continue your practice and your craft. For us, it's not always that way. And so we're always looking towards you guys for information. But sometimes it has been difficult for me in the past. I felt like maybe they didn't have time for me, or they didn't want to educate me enough, or things like that. So sometimes that was a challenge. But now that I've been in dentistry a while, I feel like I know the right questions to ask, and make them understand that this is important for not only myself, but for my profession. And I need to really expand my duties for you. And I'm not being a pain or a hindrance. I'm really just trying to expand this for our patients. But nice thing is I've learned a little bit over the years the right questions to ask. Yeah, absolutely.
For say you're working with a doctor that you found is like very easy to talk to, or just there's not that communication problem. Can you identify anything that made it easier to talk to that doctor, or?
A lot of times I feel like when I try to find something that's a common ground, I think that's always been a lot easier. You know, we may not personally have a great connection or things, but I think if we find a common ground, we're here for the same purpose, and let them understand that I'm here to be an asset and be helpful and not be, again, a pain or a hindrance.
When I started, I first started at Henderson Oral Surgery. And when I first started, I really feel like we had a really good connection.
Yes.
You were one of the first employees to come, and you sat down next to me and you said, "Hi, we haven't had a chance to talk, and I just wanted to say hi and get to know you and let you know that I'm here for you." And that really meant a lot to me. And so though we didn't always have time to talk, every time I'd see you after, it was like, it was very much a joy and a pleasure to see you and, you know, catch up with you. And I think that really did make a difference for me as a dental and oral surgery provider, you know?
And that makes us feel good. I think when we, again, have a common goal, and we're working so closely together, literally on top of each other, it just makes it so much easier and more pleasurable.
It does.
But also, I think, you know, to be complimentary to you and Dr. Steve, you know, you guys are always willing to give us that information. Like, hey, can I pick your brain? Or I need your info, or I need your knowledge, you know? And I love those teaching moments, and not feeling guilty that I asked, or that I was dumb in some way, that I didn't know that information. So I really like that, because I feel like there's things that I've learned in the past that maybe you guys haven't come across before. So it's just always a learning experience for everybody. But I like that we're doing it together.
I love that too. Do you have any advice for people that may find themselves in a difficult, like, hierarchy position where they just don't feel like they can communicate to maybe the people above them or the people below them?
You know, over the years, I've realized that, you know, you're not always going to get along or be best friends with somebody that you work with, because personalities are so different and they clash. But if you can learn how to work with somebody, like, you already know what their personality is, work around it, work with it. Try, like, there's no changing it. Let's just make it easier for both of us, and we'll find that, again, common ground, and now we can work a lot better and more cohesive together. You can fight personalities tooth and nail, but people are who they are. So that's probably my biggest thing. Like, take your time, learn people, learn how to work with people and not against them.
Of course, of course. So we had a really good conversation last week about bedside manner and a treatment coordinator's role with that. So first off, I think I have pretty good bedside manner. I mean, I pride myself in that I feel like I'm quite empathetic and I can communicate pretty effectively with my patients. So I don't think I have an issue with bedside manner. You can
you don't
ask the audience, you know, if I do or not. But it's,
so far so good.
It's you know, it's a stereotype that surgeons in general they may not have the best bedside manner compared to other healthcare providers and physicians. And ultimately, at the end of the day, I know that patients, they didn't necessarily come to that surgeon because they have a great bedside manner. They came because they want surgery, they want to get good procedure, they want good outcomes. But of course, having good bedside manner helps communicate the goals of the surgery and the goals for the patient effectively. But say a surgeon doesn't have good bedside manner, you know, you have really good, you know, insight into, like, your role with those types of surgeons.
You know, when you walk in, and again, that's first off finding out who your patient is. What's your personality? Are you looking for a bunch of information? Are you even looking at me for information? Have you done your own research? Mostly the patients that are more I'm a little afraid to be here, I'm not really sure what I need done, those are more of the people you want to coddle. And when we come down to oral surgeons, sometimes that coddle is not there. And that's okay. I feel like they're very hyper-focused on the surgery, and that's what you want. You want your surgeon to be focused on your surgery.
Yeah.
If you want the warm fuzzy, that's where I come into. I am going to empathize and sympathize with you. We are going to laugh and joke and, make you feel comfortable and confident that when you get
really
home,
good at that too.
You're going to take care
I swear,
of it.
I will walk by your room and I will just hear like laughter, and you guys are talking about like good restaurants and traveling, and I'm like, oh, I thought we were doing an implant in that room. Yeah.
But they took their mind off of the procedure and really looked at it as, I'm getting a benefit today, and feeling a lot more confident when they go in the back, which makes it
really
easier for you guys too.
It does.
Yes.
It really does. Yeah, you are really good at helping ease patients' minds and helping them get into the correct mindset for the surgery. And then that ultimately helps us communicate better with the patients when we're trying to like get down to the nitty gritty. Like, let's talk about your surgery. Let's talk about the risk benefits alternatives. Let's talk about what your goals are. And it's a lot easier when we've had someone like you that's kind of helped ease them into the whole process.
Yes.
Yeah. And
sometimes I have to be.
At that.
Thank you. I've been really transparent with some of my patients before too. We've waited for a while if you guys were in surgery or whatever. And, some of the doctors that I've worked with in the past, again, didn't have that bedside manner. And I'll be like, hey, the warm and fuzzy you're looking for is not going to happen with this one today, but it is with me. And I think when they know what to gear themselves up for and expect, there is no surprises. And it's very easy to transition.
Nothing in this world is 100%. And unfortunately, that goes with surgery. But that's what makes a good surgeon is, say you have a case that has different factors that make it so much more complicated, and maybe the time slot that was allotted for that surgery we're going over just a little bit but we know we need to spend that extra time to make sure that these outcomes are excellent. And sometimes that can, it makes our schedule run a little late, and we understand that it could make patients frustrated, but the amount of time that we gave to the patient before, we're going to give that to the next patient.
Yes.
But I appreciate that we have someone like you that can help patients, understand that, and ultimately everyone's going to get the time and the attention that they deserve and they need.
And the personal attention.
Yeah.
Everybody wants to feel important, and that's another big thing too. I always tell people, ask your patients about themselves. The one thing people like to talk about is themselves. So if you can get them that way, hook, line, and sinker.
Love it, love it. Okay, I wanted to ask you maybe some rapid fire questions.
Yeah, let's go.
What is one piece of information that you wish all patients knew before coming into the oral surgery office?
That this is surgery. We're not just your everyday run-of-the-mill general dentist. A lot of people don't realize that, and having the understanding that surgery is true surgery, things take a little bit longer. I think that's the biggest thing, and I wish that general dentists would educate their patients on that as well.
I totally agree with that. A lot of people come in and they really don't understand why I can't do the cleaning at the same time as taking out their teeth, or the filling at the same time. And while I can totally understand why you would think that you can get it done at the same time, and I know how to do cleanings.
Yeah, of course.
And I actually clean my own teeth, and sometimes I clean my mom's teeth.
Guilty.
For her. But yeah, it's people don't understand, this is an oral surgery office. We're doing surgery here, and your general dentist they do auto, they do fillings, they do crowns, they do great dentures. They are excellent at that, and I barely do those things ever. So you wouldn't want me to do those things for you. You would want me to do your extractions. You want me to do your surgery, place your implants, do your sinus lifts, remove your cysts and your lesions. But I haven't done a filling in, I don't know, maybe 10 years.
Exactly.
I don't know, maybe less.
And when you're not practicing it.
Yeah.
Yep.
Yeah.
I always give an analogy to my patients because, a lot of people remember dentistry as being one person that you saw and they did everything. And you never went to anybody else. But now we really treat you guys as true physicians. And as a specialty, you know, you go to your regular doctor and you're like, doc, my foot hurts. Well, here, you're going to go see this person. It's the same concept now. You want to be treated better in specialties than just regular dentistry. Your dentist hasn't extracted a tooth in the last year. Do you want them to do it, or do you want somebody that does it on a regular basis, that has the right equipment and tools and
I will
cleaner?
get the opposite. I will get some patients who are like, I don't know, why did my dentist send me here? Why couldn't they just do it? And sometimes it's difficult to explain, like, you know, I'll be very atraumatic with the bone. We might have to use a drill. We might have to section the tooth. We might have to use very special periotomes or elevators that there's just no reason for having on a daily basis. Even some of the instruments we have, we only whip them out maybe once a week or once a month. But I mean, when you need it, because again, every tooth is different, every patient's different.
Very much so.
But it wouldn't really make sense for maybe a general dentist to stock that one specific little elevator that maybe they will only use once in their career. Like, you know? Yeah.
And, you know, you guys are a lot more efficient, I feel like. You know, we can remove a tooth with local in 20 minutes.
Yes.
Where I hear stories from patients all the time. Oh my gosh, my dentist took one out last year and I was in the chair for 2.5 hours with a knee in my chest. Please come see us.
Yeah.
It's a lot easier.
Yeah. And again, that's not to say that the general dentist is not great at what they do. It's just we just do extractions way more. We just do them all day, every day. You know?
We stay in our lane, they stay in theirs, but that's okay, because I think people are being treated better, more efficiently. People are healing faster, bouncing back better, bones healing better. Like, there's a lot of huge benefits to be seeing a specialist.
Of course. So what's your idea of a perfect weekend?
Oh, well, I would say sleeping in, but I don't really do that much anymore. I try. But definitely spending time with my husband. We love cooking, barbecuing. He has a Blackstone now, so that's fantastic.
Nice.
We do have a pool, so we do enjoy that in the summers. But we do like spending time with our family and friends. That's is kind of our biggest portion of our lives. So we love that. We just love being around people.
Yeah, I mean, actually, just right before this, Krista shared with me her spinach dip. She makes a legendary spinach dip, so yeah.
Yeah, it's pretty good. I can't wait for you to make it so everybody will rave about it at your next get-together.
I'll call it Krista's spinach dip.
Special.
Is there anything you're binging right now?
Well,
any shows, podcasts?
We do have a little guilty one that we just started on Netflix called The Hunting Wives. It's quite racy, but it's fun, and it's quite trashy, but still really fun.
Is it a reality show?
It is not, which I would think it would be, but it is not.
Okay.
But it's based out of Texas, and it's a bunch of women that carry guns, and it's about as far as I'll go, because it's a lot of scandal and all kinds of fun things. Yeah.
I like that.
It's that guilty pleasure watching.
Is it like addictive?
Yes, very much so.
I have to really stay away from addictive shows.
Thank goodness it's only 8 episodes. So I feel like it's going to start and end.
Once I start something, if it's addicting, I can't stop. I have to finish.
Yes.
I have to know what happens.
That's when we're like, we need to make a commitment
if
we're going to be into a new show that long.
Oh my gosh.
I'm the same way.
I think, you know, when the first Squid Games came out?
Yes.
It was so good. So Anthony's my boyfriend, we went to Big Bear, I believe, and we had all these plans to go out and like go hiking or like go do all this stuff.
Squid Games.
We didn't do anything. We drove to Big Bear. We turned on Squid Games. We couldn't stop. We finished the whole season.
I love it.
And then we left Big Bear.
Picnic on the bed. That's the best.
We only watch that show. So that's what I mean by like if it's addictive. Once I start, I can't stop. So if it's too long, I probably just won't start it. Yeah.
But thank goodness not. So yeah. But guilty pleasure for sure.
Besides oral surgery, what's the best dental specialty?
I did 15 years in pediatrics and I had a blast. I do not have any children of my own. But it's been really fun to watch all those people that I treated for so many years grow up. I get wedding invitations, birth announcements, still to this day. But I worked for 3 fantastic dentists. This was in the Seattle area. And I learned a ton from them. One of them was a very close friend of mine. We actually started on the exact same week. So we really grasped onto each other very quickly. And the senior dentist that was there, I learned so much dentistry from him, to the point where I was doing things that I felt like a dentist was doing, and I felt really cool and confident. And we did like a lot of charity stuff, and we got to do a lot of extractions on our own for out of country and things like that. So I just feel like I became such a more well-rounded person in the dental field because I was there. They all came from different areas of schooling throughout the country, all very different personalities, but they were all so highly educated, and I had such a good time. But again, the kids, they're fun. They were so fun.
Sweet. I'm sure they loved you.
It was really cool. And even in those 15 years, just watching them from little ones crying, won't get in the chair, to graduating high school or college.
Wow.
So amazing. Fun.
What are you currently listening to now?
Ooh, I love all kinds of music, but I would say yacht rock, which is kind of like 70s, 80s, kind of light rock. I love reggae. Bob Marley, of course, but I love reggae. Or like 311, which is kind of that ska sound as well.
If you were gonna DJ for us, like in the operating room or like in the surgery rooms in the back, what would you DJ for us? Because usually you can't DJ for us. You're up in the front.
True.
We're in the back.
I would kill it, by the way.
I'm sure.
I was a huge raver back in the day.
Nice.
We would go, and stay all night out of high school, and Mom be like, "Okay, I'll see you at 5 a.m, because that's what time it ended." I love techno music. I love the dance, the house, the trance. I love all of that stuff. So that's what I would DJ for you guys, for sure.
Okay. What are some artists?
Ooh, I like Zed. I like
I have
Avicii.
some Zed on my,
I
got them on my podcast here.
Marshmallow.
I mean, on my playlist here.
I love a ton of people. Yeah.
Nice.
A whole bunch of them.
Okay, yeah. I nominate you to be our next DJ. That's
Perfect.
Great.
Perfect.
Okay. Krista, I want to thank you so much for joining us today.
Thank you for
always
having
love
me.
hanging out with you. You are so fun to talk to, and you're just so talented and good at what you do. I feel so very blessed that I get to work with you, and that my patients get to, not my patients, our patients get to experience this team together. You really make a difference in their lives.
Thank you.
Oral surgery can be very scary, like we talked about, and the fact that you're able to ease them into the process really does change their day. Some of them, it makes their week, and at least it can change their dental experience, so the next time they go into their dental office,
Ultimate goal.
they have maybe a different mindset or different perspective, and it's easier for them to walk back into their dental office.
Agreed.
So yeah, thanks for joining us.
Thank you.
And
Thank you
thanks
for having
being with me today.
Yay, thanks.